Good morning. My name is Cary Brown. I'm a professor here in the Department of Occupational Therapy at the University of Alberta. And what I'm going to discuss with you today is concussion and sleep. Now, some people think, well, I'll just go through the objectives first, I guess, before I launch right into the lecture, because there's a lot to cover and it's a fascinating topic that we don't know a lot about yet. So, yeah, I'm looking forward to this. So my objectives with you actually are to talk about the prevalence of sleep problems following concussion. So you see the seriousness of the problem. And then explain some basic sleep physiology, because once you understand that, you'll understand better about why this is such a prevalent problem and why some of the seemingly very simple interventions can be quite effective. Then I'm going to talk a little bit about the consequences of sleep deficiency, particularly for this client group. And then I'm going to conclude with some very again, they're going to seem like very simple interventions, and yet they're foundational, very, very important. And I was called this the low-hanging fruit, right? And we shouldn't ignore our low-hanging fruit. So let's talk a little bit about the prevalence. Now, it's important to keep in mind, and I'm sure you know this just from your own work and interest in concussion, that it's frequently underreported. There's a lot of reasons why people don't talk about having a concussion. So I'm not going to go into that. There are obviously sports-related concussions. We know they're very prevalent. And of that group, we don't, we don't have good demographics about everyone, but particularly about athletes. We know more about athletes and sports-related concussion. And that group, between anywhere from 35 to 70% of them report having sleep problems after their concussion. So we know, prevalent problem, right? Then there's also military members, and we tend not to think too much about them, but these are people who may be in active duty that we're treating, or people who are veterans, have left the forces. Typically their concussions are related to blast and blunt force trauma, but anywhere between 75 to 90% of these experience one or more sleep problems post-concussion, right? And sometimes these things resolve, oftentimes they resolve, but not for everyone. Workplace injuries. So this is another group where we're going to see a lot of concussion injuries. And the studies with these individuals, they found that 20% of workers go on to develop post-concussion syndrome after their workplace injury. And the symptoms of concussion can be very slow to resolve, and sleep deficiency interferes with healing. And I'm going to explain more about that whole bidirectional relationship to you in a few minutes. So just to keep in mind that really wherever you're seeing concussion, again, here's another group, right? We're seeing a number of people with falls, an aging population and more extreme sports and all kinds of things that are contributing to the increase in falls that are being reported. And research tells us that about 1 in 5 falls result in a head injury. So again, we are going to see more problems for these people with sleep as well, because it's all interrelated. So these are the places where we're more likely to see concussion. And, so it doesn't really matter what population you're working with. We're, youth to older adults, we're likely to experience clients with concussion, and we should expect sleep problems as opposed to be surprised by them. So we should screen for those sorts of things. We should ask right off the top, because the numbers are so high. When you think about it, post-concussion syndrome, right? The constellation of things that we see quite commonly after concussion. So headaches, look here, sleep problems right up there, right? And then all these other types of fatigue, concentration, memory. So this is part of the rest of your course. I'm not going to go into it, but sleep is recognized as one of the major consequences for a number of people post-concussion. Now, what I want to talk about a little was the bidirectional relationship between concussion and sleep. And this is a slide that was prepared by one of my grad students a few years ago. She did a study with sports-related concussions and sleep problems, and an intervention called hand SelfShiatsu, which I'm going to show you towards the end of the presentation. What she, when she put the slide together, it was to try to demonstrate that it's a bidirectional relationship. Sleep problems actually can make us more prone to injuries that can result in concussion, because sleep deficiency contributes to lack of insight, to fatigue, to poor judgment, to poor coordination, to poor balance, all kinds of other things. And concussion, the symptoms of that and the consequences of that can actually contribute to inability to sleep. So things like, worry, rumination, sensitivity to sound, headaches, those sorts of things, and the neurophysiological changes that occur. So that's what this slide is to portray, that bidirectional relationship. It goes both ways. And so although that can seem a little overwhelming, actually it should be seen as encouraging, because what that means is we can't always do anything about, the concussion. Some of these symptoms are very resistant to any type of intervention, but we can always do something about someone's sleep. And so that's, that can be your entry point at times. When I'm talking to a bunch of 14-year-old hockey players who have all kinds of, I don't know, personal attitude and almost see concussion sometimes. You've heard this before, right? Young athletes who see concussion kind of like a badge of honor, like, oh yeah, I got my bell rung kind of thing. They're not going to want to talk to me about that and risky behaviors, but they're more than happy to talk to me about sleep. So that's the entry point, right? It matches the group that you're working with, and it's sort of a low risk one for them. There's, everybody has sleep problems, so it's fine to talk about it. Sleep deficiency. So just a very quick overview of what the consequences of chronic sleep deficiency are. And I'm not talking about, 1 or 2 lost nights. I'm talking about when this is an enduring problem for people. And it's quite prevalent in industrialized countries, sleep deficiency, to the point where the World Health Organization has labeled it an epidemic. And so again, don't have time to go into all of that here, but you may want to do some more reading about it. It's a fascinating area working with people with sleep deficiency, and sleep is so foundational to function and to both emotional and physical functioning that as rehab specialists, we need to spend more time thinking about that and understanding how that works, and what the interventions are, what are the flags we should be watching for. So very quickly, sleep deficiency will interfere with healing, with digestion, with all kinds of hormonal activity. I'm going to go through a little bit of that in a minute. Central nervous system functioning and sensory processing. Oh my goodness, like this is a huge problem, right? If you are sleep deficient, you are not going to do as well. Cognitively and emotionally, we know also it interferes with feelings of well-being. It interferes with new learning and concentration, with emotional regulation, with people's mood. People tend to be more paranoid, more depressed. There's an increase in substance misuse because people try to self-medicate to either alert themselves because they're feeling really sleep deprived, or to sedate themselves because they know they need to go to sleep. So there's all kinds of things wrapped up in this, and we should not minimize it as, oh, well, sleep, big deal. We'll have a lot of social stigma to overcome around sleep. So why does sleep matter? Here's another slide I was talking to you about. So there are any number of neurochemicals and hormones that are regulated during the sleep process, and very essential ones that we just don't think that much about. So things like growth hormone, right? Antidiuretic hormone, melatonin. We hear a lot about melatonin, but it's not just for sleep, right? Melatonin is also an anti-inflammatory, so really makes a difference. Oxytocin, prolactin, these are all really significant hormonal, significant components of the hormonal system, right? So we don't want to just minimize this. Few more, ghrelin, and leptin and ghrelin are really interesting chemicals. One is to stimulate your appetite, and the other one is to suppress appetite. And what happens if you are sleep deprived, quite often they can become dysregulated. And so it's leptin to turn your appetite off doesn't get produced properly. And so instead you get this flooding of ghrelin, which tells you you're hungry, you're hungry, you're hungry, you're hungry. It doesn't matter how much you eat, you will still feel hungry. And so we see that sleep deficiency is related to obesity and diabetes and other kinds of endocrine problems. It's all I can, I keep going back to this, but it's significant. It makes a big difference. They've actually done studies with young 18-year-old athletes where they sleep deprived them. They only got 4 hours a night of sleep. And then they'd set them down and they just let them eat as much as they wanted. And they actually were able to move these young people into a pre-diabetic state in less than 4 days. So they canceled that study because the changes were so significant. And these were healthy young people, right, when they started this. So it does make a difference. Insulin, again, related to this whole process, right? Cortisol is another very important chemical we need to think about, right? Again, metabolized and processed during sleep. It peaks just before we wake up, if our body is working properly, if our systems are working properly. It peaks because that keeps us, gets us up and alert and ready to go. But then we need to clear that from our system over the course of the night and then let it build again. But that, again, if you're sleep deprived, sleep deficient, doesn't happen. Aldosterone, right, regulates sodium and potassium. Leptin, I already talked about that. Okay, so anyway, just to say, very, very important. Now, if I'll be honest with you, the more I learn about this, the more fascinated I am about sleep, because I came into it much like everyone else, just sort of, oh yeah, that's something we should learn a little more about. But then the more I learned, the more I thought, wow, there's a lot to this. And so I'm going to mention some resources during the presentation that I think you will find quite useful if you want to learn more about this. Now, Russell Foster, this is a slide from one of his presentations. He's like a sleep guru. He's a very, very wise man. Anyway, I would recommend any of his works. He's got a few short public access kinds of things on YouTube, but this is a more in-depth, this resource here is a more in-depth review he did. And the reason I grabbed this slide was just to show you that this sleep is not a static state. It's not sort of like you fall asleep and everything stays the same over the course of the night. Many things peak and valley and change and, cycle during the course of a night. So all kinds of things like hormonal production, as well as your core body temperature. And keep that in mind, because I'm going to talk more about it later, why it's important, and something we can modify, right? Something we can use as part of an intervention. Yeah, and even, your acuity, your concentration ability, it all changes over the course of the day, and the course of the night really goes down. So implications for shift workers, right? And if your ability to be accurate and to concentrate is really low at 4 o'clock in the morning, your risk for injuries that can result in concussion that much higher, right? So anyway, something to take a look at. Take-home message: concussion and sleep are bidirectional. One influences the other. Right? So it's not like, oh, well, once the concussion, post-concussion symptoms resolve, the sleep will be better. That's not the case. All kinds of habits and practices can get set up during that period. Even if you're a good sleeper before your concussion, the consequences could lead to you having chronic sleep deficiency post-concussion. Or, and we see this very often, people were just bad sleepers or had poor sleep prior to the concussion. I mean, sometimes people from childhood have established practices and beliefs and behaviors that are counterproductive to good sleep, and they bring that sleep deficiency with them through life. Now, I'm not going to talk a lot about it here, but one of the things you also want to ask about is sleep apnea, right? Again, underdiagnosed in around the world, basically. And sleep apnea is a sleep, it's a breathing disorder, right? You're basically sleep deprived and anoxic for large chunks of the night. So again, something to ask about. A lot of people go, oh, I'm snoring like a log. It was great. But that's not good sleep. People tell me that about their children. Oh yeah, he sleeps really soundly, he snores. Well, No, that's the sign of a problem. That's not the sign of good sleep, right? Snoring, it means that you're against stress. They know they're not sleeping well. And so if you're lying there at 3 a.m. staring at the ceiling, what happens? Well, you get anxious, you're depressed, you can have all kinds of maladaptive coping strategies, things I talked about before, like substance misuse or doing extreme exercise, very heavy exercise, getting up and going, well, maybe it'll tire me out. Actually, all that does is raise your core temperature and keep you from being able to sleep. So people need to be educated. We have to do things to interrupt that anxiety, depression, that anxiety, worry, and rumination cycle is really challenging, right? And some of what I'm going to talk about relates, I'll use the examples from chronic pain, because sleep is a big issue for people with chronic pain as well. And we know more about that in terms of research studies. We haven't seen as much in the field of concussion. So sometimes I'll refer to chronic pain, but it just makes sense, right? These are bidirectional relationships. And so we know that interventions to improve sleep can improve pain management. We've seen that really clearly. And so the assumption is then that sleep interventions will help with managing post-concussion symptoms as well. Certainly things that help to interfere with that worry rumination cycle are really important, because we know that sets off that whole cascade of stress response and all the sleep counter sleep neurochemicals and hormones. So anyway, that's a long babble about something that is fairly important. And I'll just move on with the rest of the presentation, because I think, it's not just about the physiology. We have to think about sleep. It's not you just take a pill and you'll go to sleep or fix your chemistry. That's not the case. Sleep is also composed of our thoughts and our beliefs and the environment that we're in. So just like pain, sleep is a biopsychosocial event, right? The whole of all of these pieces come together to be greater than, the whole is bigger than the sum of its parts. That's what I'm trying to say here. And when you think about it, so we have our biology, we have what happens after the concussion, the consequences of that, but there's the beliefs and the worry and what people are telling us, and then the demands of society around us, and even the environment, the amount of light and sound and those kinds of stimulations that interfere with sleep and certainly are more challenging to manage post-concussion for many people. So what we're looking at is what's called a human complex adaptive system, biopsychosocial. It's about a systems approach. And that means that you can enter a system at any of these levels. You could go in at the biology level, or the beliefs level, or the societal environmental level. With your intervention, you have to find out what works best for your patient and your client, because work on, how can I make my bedroom darker? Okay, simple thing. But by the same token, if I said, like blue spectrum light exposure at night prevents you from getting efficient sleep and producing melatonin, they may be very, very resistant to that whole thing, because that's just not in their wheelhouse. Relationship, they're not going to progress. You can always add things once you build that relationship. It starts somewhere that people are willing to engage. Anyway, at the end of the day, what I'm saying is the effort and results are not equal, right? In a complex system, you can have a big effort that gets you nowhere, or you can, sometimes very small things will have a huge impact. And I always, some of you have heard me talk before, but I use this imagery a lot. This is a big effort. He's not going to get very far, right? So if you feel like you're not getting very far with your intervention, maybe take a step back and think, maybe there's something else I should be doing, and maybe it just needs to be a little thing, a little nudge. So, like if I wanted to, I would say if I wanted to empty out a classroom, trying to shove everybody out the door physically by myself is ridiculous. It's a huge effort and it won't get me very far. But, if I had a bunch of people who were worried about rats, mice, yikes, and I dropped one in the room, that might get me a little bit more attention. But let's take a look at typical sleep. What does it actually look like? And then you're better able to understand, oh, actually, that's not typical sleep that you're having now. Okay, so I apologize for some of the doctoring of this slide, stages 3 and 4. There used to be a stage 5, but it was things got collapsed a few years ago, which is fine for our purposes here. So sleep occurs in stages. You go through cycles with 4 stages in each cycle, and you go through a number of these over the course of the night. Now, stage 1 is that very light sleep. You know, you've had lunch, you're just sort of nodding off, your head wobbles a little bit. That's light sleep, but you're easily woken up. This is where our bodies are just sort of getting ready for sleep. And if nothing interferes, we move into stage 2 sleep. Here, your breathing starts to slow down, your heart rate slows down, your body temperature drops a little bit, your core temperature drops a bit. Then from there, and we spend a fair amount of time in that, right? 45 to 55% of the whole sleep cycle is in that stage, but you can still be woken up from there. Stage 3 is very deep sleep. We start to see all kinds of brain activity changes. So we start to see delta wave changes. And once you get into deep sleep, sorry for some of the noises in the background, it's the Zoom thing with the dog. When you get into deep sleep, it's very difficult to be woken up. That's when people need alarm clocks and to be shaken and all that sort of stuff. And if you are woken up in deep sleep, usually you have a startle response, a stress response. So it starts that whole cascade of hormones that you really don't want floating around in your system. But from, you know, if you're allowed to just stay in this stage and move through it, then we move into what's called rapid eye movement. We see more theta wave activity here, and muscles are relaxed. Breathing is not as deep. It's more shallow. This is where it's believed that most cognition and memory consolidation and all those and emotional regulation occur in REM sleep, whereas in stage 3 sleep, that deep sleep, that's more for physiological healing and metabolism, sorts of things. Okay, so different things at different stages. Now you go through each of these, and you don't, like, if somebody wakes you up in stage 2, you can't jump to stage 4, right? It's not like playing Monopoly. We have to go through each stage. So if you have a lifestyle that keeps you perpetually in stage 2, right, because you won't get into deep healing, and you certainly won't get into cognitive processing and emotional regulation. So that's an issue. Now, some people say, well, yeah, but what about medication? Well, medicated sleep, the science is not perfect and it's getting better, but most medication leaves you in very deep sleep. You never move to REM sleep. You know, pharmacologicals are not that advanced. So what happens is people will say, I've been asleep for 10 hours, but I just feel awful. I feel groggy and icky and fuzzy and ugh. And that's because they never moved into REM sleep. Their bodies weren't able, the medication kept them in this. You'll see all the guidelines about managing sleep problems will say, you know, medication for acute stages, maybe 2, 3, 4 weeks, but you should always be working towards non-pharmacological interventions as quickly as possible. And that's the reason why, or one of the reasons why. So here are these stages we go through. Now, this is interesting. I think it's all interesting, but anyway. This slide shows us that these stages are of different length over the course of the night. So look here at the beginning. We don't get much REM sleep until, well into 5 hours or later, right? It's at the end of our sleep cycle where we're getting more REM sleep, but not tons of REM sleep. And so for that's the reason why, you know, people will say, oh, I've trained myself. I only need 5 hours of sleep a night. Well, you may only need 5 hours in terms of the physiological and physical functioning that you need to do, but in terms of periods of time, right? Let's see what else. Okay, so I don't know if we need to go through this. You're all pretty up on your neurosciences, and this is very much the whirlwind. But anyway, homeostasis, by your internal balance, it's mediated by neurotransmitters. We all know that, right? So for example, adenosine increases in response to light. So that's one of the neurotransmitters in your body that when light is perceived in the daytime, it builds and builds and builds until it reaches a tipping point. And then at a certain point in your body, it goes, ugh, that's enough, alertness. And then you feel tired. Okay. So if you haven't had that light exposure during the day, you may just end up feeling kind of groggy all day long. You never feel alert and you never feel really tired so that you're able to sleep. So you're just sort of in that, there's my technical term for the day, right? But that kind of a state. So it's not a healthy state. And the other example, melatonin, right? It increases in response to dusk, to dimness. And as the daylight decreases, melatonin production increases and triggers us to, oh, now it's time to go to sleep. But of course, we tamper with this system all the time, right? Remember, humans were kind of our wiring was set way before electricity was ever developed. And so now we have a problem, right? That's why we have this epidemic of sleep deficiency. So we can fiddle with our circadian rhythms that are regulated in the hypothalamus by, mucking around with the light, the type of light exposure we get. And most of us, that is an issue, right? We're in dim environments in the daytime. Often we're in dim offices that don't have sufficient light. We don't get outside as much as we need to. And then at night, when we should be in dim environments, we're actually exposing ourselves to a great deal of blue spectrum light. Light is composed of many colors, and it's that blue end of the spectrum that's problematic because it will suppress melatonin production. So we set up this weird tug of war. And again, just this, quick reminder of your anatomy. Those of you who go, oh yeah, right. I could draw an optic chiasma once upon a time, but I don't know if I could anymore. Okay, so how does our sleep get out of whack? Well, chronic overactivation of our stress system will do it, right? I'm going back to some of the stuff I was talking about with pain. If you understand that whole hypothalamic pituitary adrenal axis relationship with pain, it applies the same with sleep. They run along the same kind of pathways. Insufficient light exposure in the daytime and too much light at night, chronic problem, but it's the reality for many of us. So I'm just putting out a caution there. This is not about judging people and trying to go for the quick fix that doesn't recognize the context of their lives. There is absolutely no point in telling somebody, oh, well, turn your computer off 2 hours before bed. Well, I don't know what world, the person giving that advice lives in, but for most of us, that's just not possible anymore. And so we have to look at technological workarounds. Of course, that would be ideal. If you can turn it off, great, you should do that. That's perfect. But if you can't, I don't want my patients to feel judged. I want to help them solve that problem so that they can continue to do what they feel they have to do, but we can minimize the problem, we can minimize the risk. And I'll show you some of that stuff when we get to the interventions. Okay, jet lag, work schedules, people who are on varying day-night work schedules, that's a problem. Sound can really alter our sleep system. I'll show you more about that. Temperature, medications, can interfere with sleep, injury and illness, and that's what we're talking about today, right? Post-concussion, and diet. All those things can interfere with somebody's ability to regulate their sleep system. Okay, so sleep, and again, I'm relating it to pain. It's a whole body system. These things that we need to produce are controlled in the hypothalamus, and I'm just repeating myself here, but if we interfere with that system, then we have to think about what are we going to do to either bring it back into balance. And a lot of times, this is where having a systems approach to intervention is really important. Small changes make big differences sometimes. So start small. Don't go for the big ask. Turn that computer off 2 hours before bed. Don't start there. Start with something small and achievable for that person. And then they may see something. And if they don't, well, it wasn't a big cost to them, right? So, okay, that didn't work. Let's try something else small. You know, people are motivated to try these things, but you can't ask them to change too much. People's lives are very chaotic. For someone with post-concussion syndrome, the challenges are huge. You don't want to be coming in there and asking one more thing that is just going to, you know, the straw that breaks the camel's back, right? We want to help people feel empowered, not overwhelmed and completely just turned off. Okay. There's my lecture. Sorry. Well, I have one more. I'm reserving one more lecture towards the end here. Okay, bottom line, sometimes we can't do much about the other health conditions, but we can do something about sleep. So, and we know because they're bidirectional in their relationship, the physiology tells us that, the evidence tells us that, we're good to go. Okay, so what I'm going to talk mostly about, these are the environmental things you want to take a look at. Light, we want at least 1,000 lux of exposure during the day. And usually, you know, like 60, 90 minutes if you can get it, but even 60 minutes, any amount you can get is good for you. And that's 1,000 lux is what you get at a minimum on a cloudy day. No blue spectrum light at night, so under 30 lux is what you're aiming for. Now, you can measure these things or teach your clients how to measure them really easily. You get your smartphone, download a 99-cent light meter app. And, you know, people who take photographs, they use light meters. And what you would do is measure the amount of lux in a person's bedroom at night. And so they would lie down in bed like they would typically do, have their bedroom set up, you know, with their blinds closed and everything like they would. And then you hold the meter by the eye, right? They close their eyes, you hold it there, you click, and then you see what kind of light exposure they're getting. And it's amazing how much lux there is in some people's bedrooms at night. And we know that anything over 30 is going to suppress melatonin. So we're working to get rid of that lux. Sound, anything over 30 decibels will alert us. So again, do people have noisy bedrooms or where there's frequent traffic noise outside, cars, machinery, those sorts of things, even elevators, people in the hallway? In those situations, sometimes earplugs will work, not the foam things, but get the good silicone swimmer earplugs. They only cost about $10 for a pack of 4 of them, but they mold and you can get them in there really nice and snug so that, you know, they're quite effective against sound. Foam doesn't tend to be as effective. The other thing, if you are having, you can't control the noise, you can use louder noise, which is a little paradoxical, but you can use things that are a little bit louder, but that are constant. And they will block out the background intermittent noises that tend to startle us and alert us when we're sleeping. They won't startle you completely awake, but they will bring your body to readiness, and we don't want that. So things like a cheapo fan that you buy, you know, like a $15 fan where you can hear the motor running, that's a good thing. Or again, you can go and look at the apps. There's all kinds of sound apps. And we've all heard about white noise, but it's interesting. People's bodies run at different frequencies. I don't know how to put this. We are attracted to different frequencies. Some things they make us really edgy and others are very calming. Things like, for some people, a refrigerator hum just makes them twitch. Other people go, oh, don't even notice it. So their noise comes in different frequencies and they have labels that are colors. So brown, pink, white, there's all kinds of different colored noises. And so just look for one and your client can experiment. Which one works best for them? Which one puts their teeth on edge? Don't use that. Or which one sort of makes them feel calm. Some people, an increasing number of people, are finding things like talking books really good. Like, I mean, so it's a constant noise, but the voices, especially the books that are written for inducing sleep, that's what they're for, they've got that calm kind of cadence, and they're interesting enough that you're listening. So you can't be worrying, right? While you're listening, you're not worrying. And so you're not producing stress hormones, but it's not so alerting, that story, because they're actually designed to put people to sleep, right? So for a lot of people, those are quite useful. And if you just do a quick Google search, you'll find different ones. And again, people need to experiment with the voices that work for them. Some people, have a preference for the type of voice or a British accent or whatever. I just caution you. I did try one time. I really wanted to hear the end of the story, and I was driving to Manitoba. So I thought, well, I'll just slap it in and I'll listen while I'm driving. Well, I nearly went in the ditch because it had become a habit for me. I was so used to listening to this story for the last year and a half that I had never heard the end of, that it actually, I was habituated to fall asleep. And so that was a bad idea. Don't do that. Okay, sorry. Temperature. You want 18 to 20 degrees in the bedroom at night. That's sort of ideal. And because your core temperature needs to drop. If it doesn't have that little tiny drop, then your body doesn't get triggered to sleep the same way. And we all know what it's like in a heat wave when your core temperature can't go down. Now, how that relates to rehabilitation is you want to make sure that your clients, great exercise is great, but not, 90 minutes before bed, because that raises their core temperature. If you're trying to do things, vigorous activity before bed, raises your core temperature, and then you won't be able to sleep as easily. And I'm going to show you ways we can manipulate core temperature to help induce that sleep drive. And then the last thing is bedding, allergens and dust mites. And, again, very basic stuff that many of us pay absolutely no attention to. This is from a study about the exposure to blue spectrum light and how long it took after taking the light away for melatonin production to start. And, an hour after blue spectrum light is taken away, melatonin suppression is still at 70%. That's concerning. So we need to think about, how do we work around that? Well, one way you can work around, move my little picture here out of the way, okay, is to look at the devices. If you're going to buy something new, buy something that doesn't have as much light exposure, right? That doesn't produce as much lux at the beginning. You can look at filters. There's actual physical filters you can put on a laptop. There are, I'll give you some links to some of the electronic ones. They're okay. And, people say, well, I have Twilight on my smartphone. I go, that's great. Every little bit helps. They're not ideal, but it helps. Okay. So putting things on a timer, if somebody believes that they have to have that TV on to fall asleep, well, I'm not going to argue with them about it. What's the point? We'll just lose the therapeutic relationship. But they might be very happy to put it on a timer so that when they do fall, nod off, it's not going to be on all night, flooding them with blue light in the bedroom. So that's one option. Flux is a software program that you can download into your computer, and it automatically comes on and dims your screen at a certain time of night, and it makes everything look sort of orangey, but you can still see it's checking the lux level. I talked about that. Now these, my fashion statement for the day, these are blue spectrum filtering goggles, and when I slide them on, I can see everything that I need to see. Like, everything is quite crisp, but it's a different color, and it's taking the blue spectrum light out of what I'm exposed to. So I don't see anything if the screen was all blue, I wouldn't see it anymore. Actually, that's how you know you've got good goggles. There's a lot of junk out there now. I caution people to be careful when they're buying them. I recommend a couple of different companies that are affiliated with university sleep research programs. So that's these two here at the bottom, blue block glasses and low blue lights. This is out of the University of Toronto, and this is a university down in the States. So, just be careful, because there's a lot of money to be made in sleep products these days too, and there's no regulation about, what you can try to sell to somebody. So I do caution people. Okay, then equally important is increased daylight exposure. But, right, well, I'm going to talk about that in a minute. So if you really can't get daylight exposure, you could use a light box, like seasonal affective disorder boxes, light boxes. They're fairly small now and quite portable, and 2 times a day for 20 minutes. So usually like for breakfast and for lunch, and then you don't use it after that, right? will be sufficient. You don't stare into the thing, you set it off to the side a little bit at arm's length. And so you're exposed to it, but you're not, not staring at an eclipse of the sun. Be careful about sunglass use. And not to say that, we need them, and some people are very photosensitive, and this gets us into that whole issue of photosensitivity for people with post-concussion syndrome, right? But some people just wear these as a fashion statement, and so it denies them the opportunity to have blue spectrum light exposure in the daytime when they need it. So just to be a little bit more mindful about that. And even just where people sit and how they in the environment can make a difference, right? So that is that whole issue though about photosensitivity. And I hope some of you were, when I started to talk about like, well, wait, I hope you were doing that, because this is a big problem and we don't have a lot of strong research yet. There have been a few, well, one study in particular where they used blue light exposure for people with post-concussion syndrome sleep problems. It was a very small randomized control trial, and they did find that the people who had the light exposure had better sleep. And if you want to listen to the whole study, if you want to read the actual article, it's here. And if you want to listen to someone from a sleep clinic talk about that, this is the link you can. And it's very, it's pretty oversimplified, I think, but it's engaging, so it might be a good entry point for you. But we just don't have enough information, and so you've got this weird trade-off, right? Like, okay, the blue spectrum will help with sleep, but the person is photosensitive, and so what do we do about that? And so, yeah, these are not things we just try on our own, right? This needs a team approach. You need to talk to other people about it. Maybe, something to bring up, and your patient definitely needs to be part of that team, because you know how people sometimes will persevere even in something that is causing them pain, and that's the last thing we want, right? We shouldn't be using light exposure that's causing someone migraine headaches or something like that. So concussion, it's individual, and I think we really have to push for that research to be done and really keep an eye on what's moving forward. Okay, a little more straightforward: temperature. So I said you need a little bit of a core temperature drop to induce sleep. So things like taking a hot bath or a shower will do that, because it artificially raises your temperature. And then when you get out of the hot water, boom, your core temperature drops a little bit. Your body goes, oh, must be time to go to sleep. So that's a pretty easy one to do. Or holding a hot water bottle or a wheat, one of those heated wheat sacks or something like that. Those are fairly straightforward things to do. Reducing the temperature in the bedroom, right? Really, you want to try to get it down to that 18-20 range if you can. Our bodies fluctuate in terms of temperature over the course of the night, so we do need to be able to pull on and take off covers. But an overheated bedroom will prevent people from getting good sleep, as will vigorous exercise before bed, because their core temperature, we can't drop it. Okay, so sound. So sound, though it doesn't necessarily wake you up, it will increase your heart rate, your breathing, and alertness, anything over 30 decibels. And here's a little list of what that looks like. So if I'm talking about like this and you can hardly hear me, that's about 30 decibels. Okay, that's not much, right? Now I'm talking and it's about, well, I'd say it's about 70 because I'm speaking up a little bit more. So these are the kinds of things you want to just be attentive to. And again, you can get a smartphone app that does decibel readings, free, 99 cents, whatever. They're good to go. My neighbor is doing laundry and their machine is overloaded. So there you go. Anyway, I'm not going to do a decibel reading on that, but you get the idea, right? If you can't get things down quiet enough and you've tried the earplugs, then try background noise, and it will be a little bit louder, but because it's a constant hum, usually people are better able to sleep with that going on. Now, here's the other thing I was telling you about with bedding and allergens. Dust mites, aren't they attractive? All right. They eat our dead skin cells. They're everywhere. Typically, a used mattress may have, I don't know, millions of mites inside. 10% of the weight of a 2-year-old pillow can be dead mites and their droppings. Ugh, that's kind of gross. And people who wake up saying, oh, my mouth is really dry and I'm all stuffed up, and they may not have a full-blown allergy that is being diagnosed, but they could be having some reaction to dust mites. We're not allergic to the mites themselves, it's their feces, right? They drop a lot, and that's what we're allergic to. You can read more about it if you want. Now, it's fairly straightforward what to do about dust mites. You don't have to throw away your pillows and your mattress and stuff. You can get barriers. Changing your sheets at least once a week is a good idea. Pillows and stuff like that, of course, that are not easy to wash, or you don't want to throw them away, put them in the dryer. Duvets, pillows, anything that's not really that easily washed, if you put them in a medium dryer for about half an hour, it kills off the mites and shakes out other things. And so that tends to really help a lot. So those are the kinds of things, pretty straightforward, right? And most people just don't know. It's not that they're dirty, that they've done anything, that they're not hygienic, but this is everybody has mites. It's just there. So we shouldn't be embarrassed. Reserve this lecture rant, okay, for here, and it's caffeine and sleep. All right, caffeine. Now, this is interesting, right? When you're working with people with pain or people who are on any kind of an analgesic, right? Some caffeine will decrease the effects of some analgesics, so you want to be careful about that. And also, caffeine itself can cause some heightened sensitivity to pain, can cause headaches, do all kinds of things. So you want maybe to be talking to somebody's, see what kind of medications they're on, and you might want to talk to a clinical pharmacist about some of the stuff that they're taking, because some medication actually has caffeine in it to keep people alert and make them feel more energetic. But if their prescription tells them to take that at 10 o'clock at night, like 4 times a day, and the last one is before bed, maybe you need to bring this to the team's attention, and the pharmacist can get involved, and there's a different schedule that they can follow, right? So let's take a look at caffeine in itself. Health Canada did a review several years ago about caffeine, because we just think it's there, who cares, right? But it's a chemical, it's a drug, right? It has a potential side effects: muscle tremor, nausea, irritability. Think about your post-concussion client, right? Cardiovascular effects: heart rate goes up, cholesterol can be increased, blood pressure can go up. It can have effects on bone density, calcium absorption, those sorts of things. So again, depending who you're talking to, like, these are big issues, right? Maybe not for a 19-year-old. They might think, oh, well, whatever, that's, but if you're talking to somebody who cares about those things at a certain point in their life, and this is just one more cumulative problem. Anxiety, mood changes, attentiveness, and also there's been some potential link to cancer, to certain cancers, and also there is believed, but it hasn't been strongly demonstrated yet, but there is emerging evidence about the link between caffeine and decreased fertility. So again, depending who you're talking to, this is an issue for them. So Health Canada did their review, and what they concluded was that a healthy adult who no more than 400 milligrams a day, they'd likely be fine. But anything over that, they're putting themselves at increased risk. And for children, it's 40 milligrams. So not much, right? Children under 12. Then and I'm not picking on Starbucks or any of these other products here. It's just, these are the ones that they looked at in their study. And this is the table that I have from them. So Starbucks coffee, here's where it comes on the chart. It comes out to about I think it's 320 milligrams in a 16-ounce cup of Starbucks. So it's kind of off the charts, right? That's your whole daily amount, pretty much, if you have 1 cup of Starbucks coffee. You could have more energy drinks, actually, or Red Bull. You could drink a lot of Red Bull and have less caffeine than you get in that Starbucks. So green tea. So this is about being an informed consumer, right? It's not about telling people not to drink something, but just to be informed about what's in it. So maybe you don't want to drink Starbucks, maybe you want to pick a different brand. But this information is difficult to find. Well, it's not difficult, it's just that it's not on the back of the food labels, because there is no legal requirement for manufacturers in Canada to disclose caffeine content. And that also means they can supplement caffeine. You can put caffeine into products to make them even more caffeinated. And that's what a lot of the major coffee chains do, because people feel so perky after they've had the coffee, but that's because they've been over caffeinated. So if you do Google searches for the product specific and say caffeine content, that's the easiest way to get this information. You know, Folgers or Tim Hortons or McDonald's may have very different caffeine contents. This is not a naturally occurring. There's naturally caffeine in some products, but you can add to it, and that's a concern. Now, here's a perfect example. This chocolate bar, which many of you have likely seen, and maybe some of you have had, it drives me crazy because this product is highly promoted. It was on Dragon's Den, actually, is how it got its start. And what they've done is supplement the amount of caffeine in it. They've added 101 milligrams of caffeine, and they proudly, not in the very, very teeny tiny fine print here, tell you that. But it's a chocolate bar, and people buy that for their kids, right? And it's at the till, and children buy it, and adults eat them, and everybody thinks, wow, woohoo, awake. It gives me a little perk. But think about what you're doing, right? There's no law that says you can't add caffeine. And so we can be overdosing our children without even knowing we're doing it. So again, it's about being an informed consumer. And for someone with post-concussion syndrome, you might want to be looking at some of this stuff. Are they getting too much caffeine that will increase their jitteriness and their edginess and their inability to attend and all those other kinds of things that are happening, right? So, you know, just take a think about that. Again, some people might be resistant. You know, you got to find the right place. So what do? Understand the why, you know, how does sleep work and why do these simple things make a difference? Understand that it's a system that has beliefs and motivation and biology and environment and the messages you get from your friends and everything else all working together there. So you've got lots and lots of different places that you can enter the system to intervene to help your client be better. Be realistic and pragmatic, right? That whole eat the elephant one by don't ask for great big things that somebody just cannot do. You know, that good old-fashioned sleep hygiene handout that had 10 things, and the first one was, you know, if you can't go to sleep, get out of bed and do something else until you're tired. Well, I don't know about you, but at 3 o'clock in the morning in February, the last thing I'm motivated to do is to get out of bed and go sit somewhere until I'm tired, because I'm never going to go back to sleep again. That's a big ask, and there's not even a lot of clear evidence behind that. So, you know, don't be simplistic with handing out the sleep hygiene stuff. Better to find one small thing and gradually move it up. Because I don't know about you, but I've seen more of those sleep hygiene handout sheets thrown in the garbage can on the way out of the office than you ever want to think about. Increase light in the sound, cool down, right? Okay, and here's another thing that I just wanted to share. I know I'm running a little over time here. I apologize for that. This is a study we've been doing, an intervention we've been studying with a number of different people. And so we looked at hand SelfShiatsu with veterans, with young people with pain, with adults with pain, and with adults with concussion. And hand SelfShiatsu is a very simple technique that you do when you're lying down in bed with the lights out and you're ready to go to sleep. And it's very specific pressure points that points you apply pressure to, right? In a very specific pattern. And it's about that specificity that really makes a difference, because when someone is attending to that, they are not worrying about, oh my goodness, I can't go to sleep and what's going to happen tomorrow, right? Our brains can't attend to two things at one time. So we want to give people something that's engaging, but is not going to produce a stress response. So we've had fairly good response to this. People subjectively, they love it. Most people really enjoy doing it. And a lot of people apologize for never finishing the whole cycle when they're in the study. And they say, I'm sorry, I fell asleep. I didn't get it all done. Good. So anyway, this website exists. Go take a look. The video, the training video is there now. And there's a handout about how to do it. And so people, and there's an app, right? So people can just listen to the process while they're trying to go to sleep with the lights out. And we're pretty excited about it. We think it's a very useful tool. It's so pragmatic, right? Your hands, they kind of come with you wherever you are. And it's very discreet and you don't have to go anywhere. It doesn't cost anything. So, you know, can't hurt to try. Here's a few more resources for you. Dr. Kular up here, he discusses some techniques to improve sleep with chronic pain, but they may be they'll be relevant for the most part to your post-concussion clients. This is a short video I did a few years ago about for a conference talking about sleep in athletes. So just to get a little bit more background about people even pre-concussion or who have progressed past that. Sleep On It Canada is a great website. The Canadian Sleep Society put this together for the public and all kinds of information as well as current information about COVID and sleep. So it's a nice website to send your clients to. And then lastly, there's this book. And again, it's a free one that's offered by the Canadian Sleep Society. Nope, I'm getting ahead of myself. The Canadian Sleep Society, I guess it's not on this slide, sorry. You can download a book called Insomnia in Adolescents and Adults if you just go to their website. And it goes through all this biology and physiology in a very user-friendly manner. And people really like that. So this was what I was going to point out to you. Now, again, I'm just throwing in a pitch here for not necessarily people post-concussion, but this is a research study that parents can sign up for if their children are having sleep problems. And this is an excellent group out of Dalhousie. And it's one of the first e-learning programs that's available for children. So anyway, just to bring that to your attention. And then, of course, our usual list of references for those of you who are keeners and want to read more. And thank you very much for your time and attention. It's been great talking with you.